Hello.
Hey, Catherine. Cool. All right. I think we can probably get ready to start. So, evening, everyone. My name is Rowan. I am one of the physiotherapy lecturers and the admissions tutor, or one of the admissions tutors for the physiotherapy course at St. George's. So, thank you very much for joining us this evening. And I see I've got Catherine with us this evening as one of our students, but she'll introduce herself a little bit later. So what I'm going to do this evening is just go through our physiotherapy program, the BSc at St. George's, and then we can have some questions that pop up in the chat that I can address towards the end of the session. But yeah, hopefully you find it informative, and yeah, just looking forward to working with you and answering any questions a little bit later. So, a bit of an overview about what we're going to be going through this evening. So we're going to be looking at what we are working together to create at St. George's Physio. What are we looking for when we are chatting to students, when we are doing the admissions process, and what is it that we look for in one of our students to develop St. George's physiotherapists as graduates. We'll go a little bit over the overview of the course and the structure, the main curriculum, some modules and subjects and things that we'll be taking, and then how we get you to become a physiotherapist, what it entails for us as lecturers and as teachers to be able to support you to be able to be graduates. Chatting a little bit about assessment. There's always quite a few questions around that and how that might differ from school and college and previous degrees that you might have done. And then a little bit at the end to talk about why to choose St. George's. So when we are looking to create a St. George's physiotherapy graduate, there's a couple of things that we look together to try and combine so that we really get great physiotherapists out of this course. Physios that are passionate about healthcare, they're passionate about continued learning and development, and passionate about helping people. The first step that we do with that is to look at a values-based recruitment. So we look at each applicant as an individual. So while we do look at the grades, and that is very important for us, we also look at your personal statement. We look at you as a person, what you've done to show us that you're really interested in this profession and that you'd be someone who would come out as a really meaningful and great physiotherapist. Then once we've admitted you into the course and we've chosen and you've been selected to study physiotherapy, we then start to bring in some interdisciplinary learning. So it's not just about working with physiotherapists, because healthcare is about working within a multidisciplinary team. So we start working with some of our other allied health professional students, so occupational therapists, radiographers, diagnostic radiographers, paramedics, and some of our subjects will combine with them. So we're all learning from each other and learn a lot more about what the professions entail. And then we start to look at how we can promote lifelong learning and learning development, so that it's not just about learning for these 3 years that you're at university, but how you can then take this on into your profession and to continue to learn. Okay. At St. George's, we look at we have 100% employability, meaning that once you have a degree at St. George's, you will most likely get a job. Out of the recent studies, there's 100% employability, so that means that our graduates were then able to take on roles either in the NHS or privately after graduating. Okay. So our program, if we look at some of our curriculums, so the modules and structures that we take out, we look at developing professional knowledge. By that, we mean the basics, clinical skills like anatomy, physiology, pathology, looking at disease. We look at the changes that occur in the body and in our lives as a result of disease, injury, abnormal development. And we also consider different factors that affect our patients' recovery and outcomes to recovery as part of our professional knowledge. Then we start to combine that theory with professional skills. And these are more practical skills. So looking at our clinical skills, so how we work with the patient. We look at the communication, So how we then interact with patients, how we start to build a relationship and rapport with patients, as well as our colleagues and the multidisciplinary team. And we also look at developing skills on reflection and reasoning, so that we are always able to review what we've done, to see, was that the best course of action? How can we keep developing and working in the future? Looking at the positives that we've done and looking at where we can further develop, so that we can keep improving our practice and keep improving the profession. With the BSc course, you do physiotherapy over 3 years. And your first year is a lot about building the foundations. Okay? And as you can see, that's a theoretical and practical approach that we take. So one of your first modules is something called Essentials of Allied Health Professionals. So that is working with different members of the allied health profession. So as I said, OTs, radiographers, paramedics, and you start to develop that interprofessional relationship and working. Alongside that, you start Principles of Physiotherapy Assessment, which is really giving you a grounding into what physiotherapy is. We look at a lot of the assessment over different specialities in physiotherapy and some of the theory and knowledge behind that. Then as you go into your second term, after December, we start a module called Factors Influencing Professional Practice, which is done with physiotherapists and occupational therapists. And this is a lot about our communication skills and how we then become professionals. So it's more than just having the theory and the knowledge. It's how we communicate with our patients and how we communicate with our teams. And your final module, then your first year, is Pathology, Health Promotion, Rehabilitation, where you start to bring everything that you've sort of developed over the first year together, and we start to then develop that even further by looking at certain pathologies and how we would start managing the pathologies and populations around there. So you're starting to take that assessment techniques that you would have learned in the first semester, and you're then combining that with treatment and further management, which then prepares you for your second year, where we start to focus on more specific modules or specific types of physiotherapy. For example, cardiorespiratory physiotherapy, so dealing with a lot of our respiratory system, our lungs, our airways, musculoskeletal physiotherapy, which often deals with muscles and joints, and neurological physiotherapy, which deals with our nervous system and our brain and neurological conditions. So those foundations from the first year are then further developed into these specialist areas in your second year. Alongside that, we also start to bring in evaluation and research. So in your BSc, you'll work with other students in a group to do a research project. You start to develop some ideas around that project and do a proposal in your second year. And then in your third year, you will start to actually implement that study and research that a little bit more. And in your second year, we also start your clinical placements and practice. So that means you'll be going to certain clinics or or hospital settings or placements, so that you're actually seeing patients, and we're putting in those skills that you've developed over the first year and a half, and actually start dealing with patients, so you can bring in a lot more reasoning and our professional skills from there. Then taking that into your final year, we start to look at a lot more complex cases. So the theory can be a little bit more complex, but bringing in professional aspects as you're getting closer to going out into the world and being physiotherapists and graduating. So we're really getting you ready and prepared for that. You'll do your final 3 placements, which we'll chat about a little bit later, and then you start to develop further skills in that. And then, as mentioned, you will also complete your research module. So obviously that seems like quite a lot, and I've given you sort of what you might cover in the 3 years. Obviously, you're maybe not looking very far past your first year at this stage, and about how we actually go about teaching and learning, and what does that mean for us as physiotherapists. So I've mentioned there's theory, but there's also a lot of practical. So we try and combine these two sort of different approaches. So we have lectures, seminars, and tutorials where we bring about some of the theory, and we look at our reasoning and look at different cases. These are often done live and on site. There are sometimes occasionally pre-recorded online sessions that you can look at, or there may be some directed online learning that supports the teaching that you would have had in a seminar or in a lecture. We also have lots of practical sessions in our dedicated physiotherapy lab space. These are timetabled sessions, but there's also after hours access to the labs so that you're able to further develop the physiotherapy skills. Okay. We have taught anatomy in our anatomy labs. So in your first year, you'll do some anatomy to support the physiotherapy assessment. We do case-based and problem-based learning, so looking at different pathologies or cases and trying to understand how we further develop that and reason. Then we also do clinical teaching, so learning from service users, so expert patients, people who've maybe gone through the health system. We look at different simulations. So in our labs, we have some specific models that can be used to simulate a hospital setting. And then, as mentioned, we do practice-based learning, so our clinical hands-on skills with patients working in different clinical settings throughout your 3 years. We use a lot of technology to be able to support that. So while most of our course is done face-to-face, there is online access. Every lecture that we do will be recorded so that you can watch it back. And we use a virtual learning environment called Canvas, which you have 24/7 access to, allows you to have access to all course materials for that module. That will constantly be updated as the module progresses. We use a service called Panopto to record our lectures. And again, those are uploaded so you can watch those back. You can add your sort of subtitles and closed captions and things that are needed and watch it back at your own pace and separate into different blocks. We also use some other technology such as Mentimeter, apps like that, which allow us to do live polling or do questions and surveys online, but are very interactive. So really nice for sort of a competitive quiz at times, but also to ask questions where you might not feel comfortable to answer that in a big class environment, but anonymously you feel confident to answer certain questions or ask more challenging questions. So that's a really nice way for the lecturers and students to integrate well. And then we have our library, which is 24-hour access. It has a full range of higher education library resources, articles, ebooks, and physical books. So, as I had mentioned, we do a lot of practice-based learning. Physiotherapy is a very practical course and a very practical profession. We train to work with people, to help people, to work with different health systems. So it's really important that we then allow you to have that experience while you are studying. And throughout the 3 years, you'll do 5 6-week placements, starting at the second half of your second year and then continuing into your third year. You average about 35 hours per week on placement, so it mimics a normal full-time job essentially. And the patterns of working though will depend on what placement you're at. So some you might have 4 longer days and have a day off in the week. Others might be your typical 9 to 5. These placements are arranged by a specific placement team and are often located or most likely based within the M25 corridor. And we try and consider where you live so that you don't have to commute for too long unnecessarily. So we are aware of that and try and support where we can with that. We work across a variety of different sites, settings, areas of practice. So you could be working in a hospital setting. So even at St. George's, at the various wards in St. George's, you could be working at a musculoskeletal clinic. There are some opportunities to work in some sport rehab settings. There might be community where you're having to do home visits. So it's a really vast range of experiences that we allow everyone to have. And we try and allow all the students to have different aspects to it so that you're not having too much of one area. You can also have some placements that are more research or leadership based, so maybe not as much patient facing, but also helps to develop the other skills that are really important in physiotherapy and provide other professional or career paths for you to work towards. over the 3 years, you're looking at getting about approximately 1,000 hours. Those are flexible for students who might be coming from international. So we do have a fair number of international students in the BSc course. And this is just a list of some of the placement opportunities or workplaces that we might be working in. So we might work in outpatients, trauma and orthopedics, so post fractures or surgery, falls prevention centers in the community. Might be working in occupational health, so looking at areas where there's we're working with workers in factories and things like that. Might be pediatrics in the community or pediatric in a hospital. So really, really vast range of experiences, as I said. And that just mimics, again, what we have in our profession. There's so much that you can do as a physiotherapist. There's so many paths that you can take. Not all of it, as mentioned, has to be clinical. And if you are more interested in the education or research or leadership side, there's also really good support structures to get you along those pathways. So this is often where we get a load of questions about, especially sort of within the first day of someone starting, is, okay, when is our first assessment? When are our first tests or exams? And how do we assess you? So we use loads of different ways to look at assessment. We are, as I said, we are very practical. So we do a lot of OSPEs, so objective structured practical examinations, where we do practical exams where we are assessed with a model or an actor or someone like that with the different subjects. We do written or multiple choice exams, normally for EAHP, which is one of the first sessions. There's multiple choice exam. Some of the modules, depending on the subjects, will have coursework that you might need to do. So this might be a presentation, or it might be an essay that you need to write. We do reflective portfolios too. So when you're on your placements, it's really good to work on that reflective side and thinking, okay, what am I learning from this? What am I taking from this? And how can I further develop? And then the research project. Okay. And we look at doing formative and summative assessments. So formative assessments is this assessment for learning. So it might not actually count towards your grades, but it helps to support you and prepare for your assessment for each module. And then we can do a summative, which is your assessment of learning. So essentially your test, and where you might be given grades or pass, fail, and you work towards that at the end of the module, trying to integrate what you've been learning. And that can be tested in a variety of different ways. And we try and keep it interactive and variable so that you are getting these different experiences. So when we are looking at selecting who comes into the physiotherapy course, we look at our entry requirements. Sorry, this should say BSc physiotherapy, not MSc at the top. But the information will be for the BSc. So we look at academic, non-academic, and then we do an interview. So the academic and our entry requirements are as stated there, and those are on the St. George's website for physiotherapy too. So obviously we have students that come from various backgrounds and are studying at different levels and coming through different areas. So for the BSc, it really changes, lots of different options in terms of where you can come in for, but those are the entry criteria that we would have for our BSc. We then look at our non-academic. So as I mentioned, we will look at a personal statement for everyone. We look at a commitment to physiotherapy. So understanding what physiotherapy is and what it might be as a profession, and explaining why you want to go along that route. So some students might have very personal experiences that they've worked with physiotherapists themselves, or they've had physiotherapists working with their family and have detailed sort of what they've learned from that and what they enjoyed. Or you might have a real passion to work with people, you love anatomy, you love sort of that relationship of working and helping people, and that could be something else. So really sort of displaying that. We look at different work experience that you might do. And also just to check that you are meeting so the NHS key values, which I'll link to a little bit later. And then we do things like our police and health checks, your DBS checks as well, to make sure that everything is fine for you to practice. So again, as I said at the start, it's not just about that academic side. We're looking for applicants and students that are keen and driven to be physiotherapists and to take the profession forward. And then finally, we do multiple mini interviews, which everyone will do. They can generally in person, but sometimes we will do remote MMIs. Okay, and an MMI is a multiple mini interview. Essentially, there are 6 stations, and applicants will rotate around these stations to be interviewed by a number of different individuals. Normally, other lecturers. Sometimes there might be other students on the course or members from other teams. We have this variety of different interviewers so that we can try and reduce the risk of bias, and also helps us to get very different insights into someone's behavior and someone's skills and attributes, because everyone is different and everyone will view someone differently. So we get really good aspects and understanding from them. We use this to assess your ability to reflect, reason, and communicate with people. And the stations allow for a number of different tasks or roles. There may be a bit of role playing, problem solving, as well as some traditional question answer sessions. Each station that we have is based on an NHS core value, and the NHS core values are here. So we're looking at working together for patients, respect and dignity, commitment to quality care, compassion, improving lives, and everybody counts. These are the things that you want to consider when you're preparing for your MMI, but also preparing your personal statements and thinking about how have you maybe exhibited this or shown this in your time at school, or how are you working towards this in the future. So just to wrap up, I want to just have a little bit of chat about why to consider St. George's. So looking at the physiotherapy course specifically, we are a diverse community, not divisive. We're a diverse community of students and staff. And we have students, as I said, from international students. We also have staff who didn't necessarily train in the UK and have a very international perspective too. We have very committed personal tutors. So each student will have a personal tutor that they have throughout their 3 years to provide personal and academic support throughout that time. Okay, to be there to help you if you're struggling for assessments, but also if there's something else that's going on behind the scenes, and to be someone to support you throughout that. We have fully equipped physiotherapy labs, which have recently been renovated. As mentioned, they have after hours access. So if you're wanting to put in some extra time to be able to practice your clinical skills, that's something that you can really work on. And within these physio labs, they also specialize simulation areas, which allows us to practice hospital settings, but without the stress of the hospital environment around there. And we also have a team of great lab technicians who help support us and set up the labs and make sure everything's running smoothly at all times. The course is taught by experienced clinicians and academics with experience across a whole lot of different specialities. So a lot of our lecturers are still working clinically too. So they're really up to date with what it means to be practicing, keeping up to date with the research, and often can bring and integrate that into your learning and development. As mentioned, we have specialist placement support. So we have a dedicated team to make sure that you're going to the right placements and you're supported while you're on placement. And we also have this interprofessional learning opportunity. So we're often working with other members of the allied health professional teams and our other colleagues and students throughout different degrees and modules. That's it for me for now. So obviously if any questions can be popped into the chat, which we'll address at the end. But I think Catherine is now going to do her chat for you. So I'm just going to stop sharing.
Hi everyone, my name is Catherine and I am a second year bachelor's physiotherapy student. I am an international student. I am from Canada and I am currently living in Halls. Horton Hall's the residence accommodation for St. George's, and I have been for the past 2 years. Um, yeah, so in terms of my experience, I did a previous degree in Canada, a bachelor's in biology, and I worked a little bit and decided to come back to school. And I looked for schools that would potentially give me the opportunity to go back to Canada and practice if I felt that was an option for me, and St. George's was one of those. One of the things that really stuck out to me in terms of St. George's was the small cohort size. My previous degree was a very large program, and my cohort for this year is about 60 students. So it has really helped me feel not like a number, not like a student ID, but as a actual student who has lecturers who care about my growth, and they know me by name, I know them by name, and I'm able to get the support that I need to help me learn and grow. So yes, if you have any questions for me in regards to what it's like to be an international student, what it's like to live in halls, I also work part-time, and if you have any questions regarding how to balance any of those things, feel free to ask me in the Q&A, because all of those things apply to me. And I think for myself, um, when I was a prospective student, what I wanted to know most of is whether or not there would be people who are like me in my program. And there are international students, there are mature students, there's also students who have just come from their A-levels, so it's a good mix. And in general, my entire cohort really loves to learn and grow, and that was something that I was really hoping to find. Yeah, so that is a very short introduction about who I am and my experience so far. And I'm very happy to answer any other questions that you might have.
Great. Thanks, Catherine. So I see there's a couple of questions in the chat. So if there's anything else that comes up, please pop it in. So Poppy's asked, what is the ratio face-to-face? So we are predominantly face-to-face. With physiotherapy being a very practical course, we like to have everyone on site. So your days might be split a little bit, where you'd have a lecture in the morning, but then a practical session in the afternoon. Or later in the morning. So generally you're on site most of the days. With your first year, you're not generally having to come in every single day. So the first years currently are maybe having lectures on Monday, Tuesday, and Thursday, with some remote learning on a Friday. So if you have other commitments or are taking some part-time work, there is some flexibility to try and help with that. But we are predominantly face-to-face. And Jenny asked how many students. So as Catherine said, there's about 60 in her cohort this year, but we are normally aiming for around 60 to 65 students per year. And then within that, we tend to split the groups into smaller practical groups. So there'll be groups of about 20 students. Everyone's getting the same learning, but it means that we're able to really support everyone, because the groups are then much smaller. We're able to, the lecturers are able to be a lot more hands-on and practical and support everyone, so that everyone gets really good learning from that.
I think that next one's for me. I am enjoying the course so far. My previous degree was in biology, and it wasn't hands-on, so I ended up getting more of an administrative position afterwards. But I really missed the ability to interact with patients. And yeah, physiotherapy is a perfect opportunity to have that hands-on experience. I definitely have a fascination of anatomy and how the body moves and how it works. And once again, physiotherapy that's the focal point. So I have been really enjoying learning more and just finding and understanding the theory behind why our body works the way that it does, and then in turn learning how to treat it and make it better.
Great. Yeah. Any other questions? I think maybe what that links into, and it was maybe what I was saying, is that sort of because we are so practical, it gives you sort of these different experiences, maybe different to any other degree if you've done any studying before, any different to anything that you might have studied or how you studied at school previously, and it it really just opens up your career pathways. You could be working as a physiotherapist your whole life, but work in so many different fields within that. There's just so many opportunities within physiotherapy, and it's a profession that really supports you throughout your life. A bit of my own example. So I've been working clinically for about the last 12 years, but then have now also started in the education side because that was really a passion of mine. So there are those opportunities to go into research and education. A lot of physiotherapists and allied health professionals also go into big leadership and management roles too, which are a very different approach. But the skills that we teach you and the sort of foundation that you get at university really supports you with that. All right. So there can be some financial support for travel to placements. So it is on the website. It talks about that additional financial support. So that is something to look at. And then in terms of the accepting of foundation students, so that is something that obviously we can consider. All the entry criteria will be on the website. So what would happen is that you would then submit your grades and the foundation course that you did, and we would see if it meets the requirements that we are looking for. But the website helps to be a little bit more specific with that too.
If you wanted to email study@sgul.ac.uk, and you gave your credentials over regarding your credentials, they might be able to help you further. Maybe I am highlighting what it is that you did as a foundation student. Normally it is case by case, but they might be able to help you if you are able to provide enough information.
Catherine, do you want to just put that email address in the chat, if that's okay? Great. And I'm also just going to put my email address because I think it was at the start, but you might have missed it. And something that if there are any further questions, we're happy to for you to email me to ask anything that comes up after the talk. The Poppy said yes, the placements are assessed. So generally what will happen is you'll have a practice educator. So you'll be assigned one of the clinicians on that placement who will then assess you throughout. So it's a 6-week placement. Normally you have a midway assessment, so just to make sure that you're on the right path. And at that time, you will also have a meeting with what we call a link tutor. So it'll be a lecturer who is your tutor while you're on that placement. And they'll normally meet with you and your practice educator to see how things are going, to make sure they're on the right track. And if not, then to get some further support or what else needs to be done. And then you'll get a grade at the end of the placement from the educator, but it's based on a criteria that is designed by the Chartered Society of Physiotherapy. So it's different criteria, different rubrics. So it's not just, you don't have to do an exam for your placement necessarily, but they'll grade you on how you've performed in different aspects throughout. And Mina, there is an opportunity to do a placement abroad. would normally only be one placement, and it's generally your final placement, but that is something that can be discussed with the placements team. As we mentioned, we do have a fair number of international students, Catherine as an example. So some students do like to go back home and do a placement around there. Catherine, I don't know if you wanted to add anything more on that. I can't remember if that was something that you were considering.
Yes, so that's what we've been. I haven't done a placement yet. We started in February of second year, but they do provide us with an opportunity to do a placement abroad in our last placement in third year. Um, it is something that they do not coordinate for you. So if you had ties with back home that you knew that you would be able to do a placement, then you would be coordinating it yourself. But it is an option for you. And if you had any national requirements going back home in regards to placements what you with what your country needs, then you can let placement know, and they would try to accommodate as best as they can. And I see, do you feel well supported in your studies? Yes, I feel like it is a large difference from my previous degree when there was thousands of us in my program. Um, so Rowan's one of my lecturers, and he knows who I am, and I'm able to go and ask him questions, and especially with also being assigned a peer tutor who stays with you throughout your 3 years. They are the person that you go to for both academic and non-academic needs, and you get to build that rapport with your peer tutor, so you're able to ask them about things that may impact your studies, and they'll help you find solutions as well. How do you find balancing a job as well as being a student? I'm not going to say that it's easy. You definitely have to work to make the time, but I think that if you make sure that you're managing your time correctly and that sort of thing, then it's definitely doable. Um, especially especially in times like I know in the first year you're not in class as often, I don't think. I'm not sure if that's changed since last year, but you do a bit more independent study in the first year for myself. It did give me more opportunity to work. Of course, you'll have to consider when you're doing placements if you feel it's the best idea to be in placement, which is essentially a full-time job, and then also do a part-time job. But you're going to find your routine, and then you're going to find what's best for you. So for me, I do a lot of part-time jobs that are based off of my availability week to week. So it really makes it easier in terms of finding finding what works best for me, so that I can manage both school and a job.
All right. And then, so how many practical sessions are there a week? So that really depends on the module that you're taking at that stage. So things like POPA, so your principles of physiotherapy assessment, is quite a lot of practical throughout the week, and even in that day you might do 3 different hour-long practicals. So your 3 groups will kind of rotate between different subjects and different aspects of the practical. You might have some days which are more tutorial and lecture based, and not as practical and more theoretical, but it really is dependent on the module that you're doing. And also, as I mentioned, in the first year, you kind of have generally a Wednesday, especially in the first term, generally have a Wednesday off. We don't put too much on a Wednesday, so you have a bit more free time with that. And most likely on Fridays you wouldn't be on site. So your main teaching days in your first year are normally Monday, Tuesday, and Thursday. So it gives you a little bit of time off. There might be some recommended reading or directed learning, but that just would need to be done by a certain time period. So you could do that earlier or later in the week, depending. So I think that kind of answers Mina's question. It's not necessarily always a specific day off. And when you're on placement, so going later into the course, you might not have a day off. You might have your full sort of Monday to Friday, but that would change depending on the modules and how far along you are in the course. So I think what the plan is that there will be some offer holder days, Nikki, which will then allow us an opportunity to do a bit of a tour around the university, show the physiotherapy labs and things like that, and the resources. All right. Okay. Yeah, I think that seems like it is like everything now for the questions. We can, if there's anything else, we've still got a couple of minutes. I think, yeah, so we've still got a couple of minutes, but if there's no other questions, there is another chat room on the main page that you can always ask some other questions. It looked like someone was maybe about to start typing there, so I'll give it another minute. If not, then we can sort of stop the stream and anything else can be asked in the main chat room. So in terms of interviewers, there's the 6 stations that you have. But in terms of number of people who are at the MMIs, that can vary depending on if we're doing a full day session or if they're having double sessions. So sometimes we'll have sort of 2 sets of the 6 going on at the same time. So it varies depending on how the admissions teams are setting that up. But normally you would have sort of 4 minutes at each station, and then there'll be a bit of a presentation by either me or my colleague Sanchez about the MMIs and about the course. But it can really vary. Okay. So what I think I'm going to do now is I'm going to end the stream, and if there's any other questions, you can just navigate back to the main page, and there will be the healthcare chat. But thank you very much for the questions. It's been great and really great that so many people have interacted, and thank you for spending a bit of your afternoon and evening to come to the chat. And thanks, Catherine, for your input and your experience with it.